Colorectal cancer is a serious health concern that affects millions, yet many are unaware of its warning signs and prevention strategies. In this video, we'll explore the 6 key signs to watch for, emphasizing the importance of early detection in improving survival rates. We'll also discuss practical lifestyle and dietary changes that can significantly reduce your risk, empowering you to take control of your health and join us in the fight against this devastating disease. By understanding the facts and sharing this knowledge, we can make a real difference in raising awareness and potentially saving lives. Change in bowel habits. Be aware of changes in your bowel habits, such as increased frequency, diarrhea, or constipation, as persistent changes could indicate an underlying health issue. Common causes include irritable bowel syndrome (IBS), inflammatory bowel diseases (IBD), celiac disease, thyroid disorders, and colorectal cancer. While many changes are not serious and may resolve on their own, you should consult a doctor if you experience persistent diarrhea or constipation lasting more than a few days, blood in your stool, unexplained weight loss, severe abdominal pain, or inability to pass gas. Your doctor will assess your symptoms and medical history and may perform tests such as blood work, stool samples, or imaging to determine the cause. Treatment will depend on the underlying condition and may include dietary changes, medications, or surgery. It's essential to address any persistent changes in bowel habits, especially in individuals over 50 or those with concerning symptoms, to rule out serious conditions. Blood in stool. Blood in stool can appear as either black, tarry stools, or bright red blood. Black, tarry stools, known as melena, typically indicate bleeding from the upper gastrointestinal GI tract, such as the esophagus or stomach. The blood appears dark due to digestion, which alters its color and texture. This condition is often associated with serious issues like peptic ulcers or cancers of the upper GI tract. Individuals experiencing this symptom should seek medical attention promptly. Bright red blood in the stool usually signals bleeding from the lower GI tract, including the rectum or anus. This type of bleeding may be caused by hemorrhoids, anal fissures, or diverticular disease, but it can also indicate more severe conditions like colorectal cancer. It is crucial to consult a healthcare professional for a thorough evaluation, which may include stool analysis or endoscopy, to determine the source of bleeding and initiate appropriate treatment. Abdominal pain. Severe cramping or discomfort during bowel movements can indicate various underlying health issues. Conditions such as irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), or infections may be responsible. If the cramping is new or persistent, it is essential to seek medical attention. Accompanying symptoms like changes in bowel habits, blood in the stool, or unexplained weight loss further emphasize the need for evaluation, as early diagnosis is crucial for effective treatment. The severity of cramping can vary and may be accompanied by bloating, gas, or nausea. A thorough medical evaluation typically includes a detailed history, physical examination, and possible diagnostic tests such as blood work or imaging studies. These assessments help rule out serious conditions like colorectal cancer or diverticulitis. Therefore, anyone experiencing significant abdominal pain during bowel movements should consult a healthcare provider for proper diagnosis and management. Fatigue. Unexplained fatigue, especially if prolonged, could be due to anemia caused by bleeding or the cancer itself. Anemia occurs when the body lacks sufficient healthy red blood cells, which are crucial for transporting oxygen throughout the body. This deficiency can lead to symptoms such as persistent fatigue, weakness, and shortness of breath. In the context of cancer, fatigue can manifest as an overwhelming sense of tiredness that does not improve with rest. This type of fatigue, often referred to as cancer-related fatigue, can be attributed to the disease's metabolic demands and the side effects of treatments such as chemotherapy and radiation.